Hi, I'm Matt Powell, and I want to share with you the most common mistake I see people make in their personal injury case, and that is the mistake of allowing gaps in their medical treatment. What do I mean when I say gaps in treatment? A gap in treatment is a period of time in which a patient misses treatment with one of their healthcare providers. Sometimes a gap in treatment may have a good explanation that won't hurt your case. For example, a death in the family, an emergency, or a family vacation. If one of these situations were to arise in your case and you miss a treatment, make sure you tell your doctor why you missed the medical appointment so that your doctor can write down the reason that you have a gap in your medical records. Now, let me explain to you about serious gaps in treatment that in many situations can kill your case. I'm talking about gaps that can cause you to lose thousands of dollars off of your settlement. And some of these serious gaps are caused by your doctors not knowing how to manage your care as it relates to your case. The biggest mistake I see is that when a client thinks that they've been finalized or they've reached maximum medical improvement, when this happens, they think, hey, I'm done with my treatment. Now I don't have to do anything else, and the lawyer will settle my case. This is an expensive mistake to your health and your settlement, and let me explain why. You need to know that there are two types of medical care. The first is rehabilitative care, and the second is palliative care. Rehabilitative care is when the doctors are trying to stabilize your injuries and keep you from getting worse. Once you're stabilized, then they try and heal your injuries. For example, a broken leg may require surgery, followed by casting of the broken bone so it will maintain alignment while the fracture heals. Then, after your cast is removed, your doctors will prescribe physical therapy to improve your strength and flexibility and to train your muscles and ligaments to function better. In other types of injuries without a broken bone, the treatment is usually designed to reduce the pain and inflammation around the damaged part of your body. This is to help your muscles and ligaments return to normal, to take the pressure off nerves that can cause pain, and to break the pain cycles caused by the injury. Then, once the healing begins, the doctors will change your treatment plan to help heal the body with strengthening and flexibility types of treatment. The American Medical Association says that this first phase of treatment in most cases should take about 6 months. After 6 months of rehabilitative care, you should reach a medical plateau. In other words, you've reached maximum medical improvement, commonly called MMI. Unfortunately, some doctors and many patients think that this is the end of their treatment, which is 100% wrong. MMI just marks the shift in treatment from rehabilitative care to the second type of care, which is called palliative or maintenance care. Palliative care is specialized care focusing on providing patients with relief from their permanent symptoms and the permanent pain caused by their injuries. The goal of palliative care is to improve the quality of life for the patient, to prevent and slow down the effects of degeneration, such as arthritis, to keep your function and mobility as high as possible, and to prevent setbacks. The palliative care is provided by a team of doctors, nurses, and other specialists who work together with the patient to provide an extra layer of health. This care is designed to maximize your function, reduce flare-ups and setbacks, and to promote the highest level of health possible. Examples of this type of care can be stretching, strengthening, massage, chiropractic adjustments, physical therapy, continued medication, and occasional reevaluations by orthopedic surgeons, neurologists, and physiatrists. So how do these different phases of treatment relate to your injury case? Everyone understands phase 1, rehabilitative treatment. It's like you don't have a choice. If you don't get treatment for your injuries, they will get worse and not better. So most everyone understands that if you are hurt, you will seek treatment. But when the first phase of treatment is over, many people just stop because they don't understand the value of maintenance care. They simply think that they've gotten as good as they're going to get, so they stop treating. And this is a big mistake because continued treatment will prolong how long you feel good. In other words, if you don't maintain your health, it will start to gradually decline. Sure, no one likes to go to the doctor, but think about it this way. If you continue your maintenance care, you will feel better, have more energy, and function at a higher level. This will extend your good health and slow down the long-term effects of arthritis. However, if you don't do the maintenance and palliative care, your body will experience the effects of arthritis faster and sooner, as well as degeneration of the joints and ligaments and tendons. As a result of not getting your maintenance care, you will experience a rapid decline in your health and end up needing much more serious treatment in the future, such as pain management or surgery. Let's look at this graph to help understand the different phases of your health care. In this graph, we start with the green line representing you being at 100% perfect health. You are living life, doing well. Then suddenly, you're involved in a serious accident. You are injured badly. Your health drops immediately to 60%. You start going to the doctors. You begin the healing process. Your health slowly improves over time. As you get close to 6 months of treatment, your healing begins to level off. It reaches a plateau. This plateau is called MMI, or maximum medical improvement. MMI basically means that even though you could get more treatment, you won't get much better. In this example, you are at 80% of your health. You have maximized all that you can from your rehabilitative care. Since you are at MMI, your treatment needs to shift over to maintenance care. At this point in time, you should begin your palliative or maintenance care, which is represented by the blue line. By continuing to get monthly care, you are able to maintain the highest level of your health possible. You maintain your health around the 80% level. In contrast to receiving ongoing maintenance care, if you follow the orange line, which represents your health without palliative care, your health begins to fail. Your body starts experiencing accelerated degeneration of your spine, joints, and ligaments. Because you are not getting maintenance care, you are starting to slip back and lose your health. You start feeling pain. You become stiffer, lose your range of motion. Eventually, you may have so much pain that you have to go see a pain management doctor for spinal injections. And if you still don't get palliative or maintenance care after the pain management, your health will continue deteriorating until you might need a surgery. Then, after the surgery, you may find that your health does not improve much. Your downward loss of health and quality of life can be devastating and totally debilitating. You may not be able to work or enjoy your life. My point is this: if you don't take care of your health after a serious injury, you will sadly be surprised how quickly the irreversible effects of arthritis and degeneration have on your body. Now, let's look at the same graph again, but factor in the medical costs between getting palliative care and not getting the maintenance care. In this example, your maintenance care costs are $3,000 per year for life. So, in the beginning, with maintenance care, your medical costs are higher, and at year 5, your total cost of treatment is $15,000, while the person who chose not to get maintenance care has no expense. But let's assume after 5 years of ignoring their injuries, they start having bad pain and need spinal injections that cost $25,000. Now, suddenly, they have higher medical expenses caused by the need for pain management treatment. Also, their health has deteriorated due to the lack of palliative care. Now, their health is close to where they were when the accident happened. Then, after 5 more years, they need a spinal surgery that costs $140,000. Now, there is no comparison. The person who went without the palliative care has much higher medical bills, $165,000. Then, add the cost of reduced quality of life. They have to endure all the long-term effects of arthritis, degeneration of their discs, joints, along with the pain associated with pain management and spinal surgery. The person struggling with their deteriorating health is probably not functioning at a very high quality of life. Their income may be down. They may not have health insurance. They may be required to get Medicaid for their treatment. They may be forced to stop working. It's a sad situation for these people. I think these two charts make it clear that life without maintenance care is more expensive to your health and finances. Also, think about this. Star athletes who are in great health and injury-free still take advantage of palliative health care to maintain their high-quality health and maximum function. So back to your injury case. At the end of your rehabilitative care, when you reach MMI, the doctor will likely write down in your medical records what he thinks your future medical needs will be as a result of this injury. He may be very specific. For example, he may say monthly massages and stretching, or 6 weeks of aggressive palliative care once per year, or 1 MRI every 2 years, or yearly evaluations with a neurologist. And these future recommendations are usually for the rest of your life. So as your lawyer who's explaining how expensive your future palliative and maintenance care will cost to an insurance adjuster or to a jury, I have a hard time with my audience when your records show that even though your doctor has told you what you need to do to maintain the highest level of health possible, you've not followed his recommendations, and you now have a big gap in your treatment. This causes a jury or an insurance company to say to themselves, if I was hurt, I would keep treating. So your client must not be hurt too bad since they have stopped treating and they're not listening to their doctors anyway. So let's not give Matt's client any money for future care and treatment. Or if the client acts like they don't need future care, why should we give them any money for it? To quote Benjamin Franklin, "Well done is better than well said." So now you understand that by allowing gaps in your treatment, you can cause a lot of problems for your case. First and foremost, your level of health declines, and secondly, the value of your case drops dramatically. Think about how expensive your treatment has been so far. Now think about the cost of continued treatment for the rest of your life. In my little example, the yearly cost of the minimum prescribed maintenance care will easily be close to $3,000 per year. And in many cases, the maintenance care for serious injuries can be as high as $20,000 per year. So think about how many years you're going to live and the total cost of the care that you are entitled to. Remember, your injuries were caused by some other person's negligence. And if you don't keep up your treatment, then why should anyone pay you for your future medical care? If you don't treat at least one time per month, even after MMI, you are really hurting your case. So if your doctor says you're through with your treatment, let your lawyer know immediately. Ask your doctor about this. Ask him, well, what are we going to do to help maintain the level of health that I have today? And ask him, what are we going to do to prevent the degenerative process from taking over? And ask, what are we going to do to delay the arthritis and degeneration? If your doctor says nothing, look for another doctor. Find a doctor that is thinking about the long-term effects your injury will have on your life. When a doctor tells you that you are finalized or you are at MMI, what is really happening is that you are not through with treatment. You are just at the second phase of your treatment. By understanding why continued care and treatment is so important, I hope that you have a longer, healthier quality of life, and that the at-fault party should pay for all. And when I say all, I mean all the future medical care and needs that you will need to maintain the highest quality of health possible. If you have more questions about gaps in treatment, please call me. My final advice is that you see at least one healthcare provider once a month until your case is over. That will preserve the value of your case. Thank you for watching my video.